Namaste Bitya. Hamisha खुश रहो बिटिया. A very good morning to you all. Myself, JV'n Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine, in Faculty of Homeopathic Science at JYOTI Vidyapeeth Women's University, Jain. In today's lecture, we are going to discuss about the history taking in psychiatric cases. Whenever a patient of psychiatric disease is coming to you, how you are going to take the history in such a patient. First of all, we are going to ask the presenting or the chief complaint from the patient. The presenting complaint and or the reasons for consultation should be recorded. Why that particular patient is coming to you, you have to record that particular reason. You have to ask about the presenting complaint in detail. Both the patient's and the informant's or attendant's version should be recorded separately. So you have to record the problem from the patient's mouth. You have to record it completely, and then the complaints, as mentioned by the attendant or the informant, has to be recorded separately in absence of the patient, so that you can get a clear picture of the disease. Then you have to inquire about the past medical and psychiatric history from the patient. Past medical and psychiatric history has to be taken out. The history of similar or any other psychiatric illness in the past, if present, should be obtained. Past history of the psychotropic medication, alcohol and drug abuse or dependence, and psychiatric hospitalization should be asked for. So you have to inquire about the history of similar or any other psychiatric illness that has been present in the patient in the past. If present, it should be obtained. Past history of the psychotropic medication, alcohol or drug abuse, or dependence and psychiatric hospitalization should be asked for. Then you should inquire about the treatment history. If any, a patient has been taken in the past, then you have to inquire about the treatment history that is given in the present episodes and the previous episode should be asked in details, along with the response to the treatment, so that you can get the clear picture of the disease and you can find if the present disease is due to the side effects of the past medications. Then you have to inquire the family history of the patient. Similar, in the family history, you have to inquire about the similar or other psychiatric illness that is present in the patient, major medical illness, alcohol or drug incidences, and suicide should be recorded in a particular patient. Some diseases are having genetic origin, hence the family history is very much important. Then you have to inquire about the family socioeconomic status of the patient. Some circumstances, per capita income, socioeconomic status leads to the family, normal as well as functional, and current attitude of the family members towards the patient illness should be noted. So family history or the socioeconomic history is also very important in the development of psychiatric disorders. This has to be noted down. So this was all about the history taking in the case of psychiatric disease. What are the various things and questions you need to ask in case of psychiatric disease? This was all for today. In the next lecture, we are going to discuss about the common symptoms of anxiety disorders in the pictured form. This session is powered by Digital Version 2.0, Jyoti Vidyapeeth Women's University. I hope you are satisfied with my digital session. If you have any query, please mention in the comment box and I'll try to resolve. This was all for today. Thank you very much. We will be meeting in the next lecture tomorrow. Thank you.